Okay, the situation given is Miss Z, 50 years old with advanced kidney disease, ovarian cancer, admitted for severe fluid overload, requiring urgent dialysis in view of poor IV diuretic response, where patient developed hypocalcemia and hypotension during the dialysis and developed seizure. So, but it was resolved after the correction of the calcium. So, patients' relatives who are not satisfied with the outcome requiring explanation. So, what I will do is that first I will ask the relatives to come down and then bring them to a closed or quietest of place where we can sit and discuss regarding the patient's condition. So first of all, patient have been having advanced kidney disease where the kidney is not functioning properly and cannot filter the waste products and also the fluid, causing it to build up in the body, resulting in fluid overload. As well as ovarian cancer. Ovarian cancer will have a complication of fluid overload where our lymphatic system is blocked and the fluid will build up in the tissue or other organs, resulting in fluid overload. And the reason we have to explain regarding the patient's condition first to the relatives so that they understand what is the underlying issue that the patient is facing. So and then we've been trying to help patient by giving IV diuretics. The IV diuretics function is to get rid of the excess fluid by increasing the amount of the water and salt excretion into the urine. But since patient is having kidney problems, so the function of the kidney of excretion of the water and the salt is not functioning properly, thus causing the poor response to IV diuretics, so requiring urgent dialysis for this patient. So we have to explain regarding the reason why we end up doing urgent dialysis for this patient. And then while doing dialysis, patient developed seizure. One of the complication that can result while doing the dialysis, because due to the rapid clearance of the substance like urea, fluids and also electrolytes in the body, causing imbalance in the electrolyte and resulting in the hemodynamic changes and can cause patient to have seizure. So we have to explain regarding this to the patient's relatives as well. And also hypotension is one of the common cause that the patient can encounter during dialysis, where we call this as the intradialytic hypotension, because of the hemodynamic changes and the biochemical changes in the body due to the fluid removal, causing the drop in the fluid in the body level, resulting in hypotension. This is a very frequent complication that we have to explain to the relatives as well. We around 10 to 12% in kidney patients who are undergoing dialysis can have these hypotensive episodes. So after describing regarding the event, I will explore regarding the feelings of the patient and also the patient's relatives. So we have to understand what are they going through, what are the emotions, or what are the expectations from the patient as well as from the relatives. And then I will try to evaluate the situation regarding what has gone wrong and what have done good for this patient. And from that we will analyze. From me, I will try to analyze whether I will ask for the history regarding is there any other underlying issue that the patient is having, whether patient was on any restriction of fluid which patient didn't follow, resulting in the fluid overload. Was patient on any antihypertensive prior to the dialysis, because maybe it can further drop the BP while the patient is going dialysis, and was there any correction done prior to starting the dialysis, whether the blood parameters, whether we have to look out for any hyponatremia, any hypocalcemia, any other electrolyte imbalance which was not corrected prior to the dialysis, resulting in further drop of the electrolytes and resulting in seizure for this patient. So these are things that I have to look out in view this situation have already occurred. And I also have to explain regarding the complications of the dialysis in this patient to the relatives, because patient who is undergoing first time dialysis have a higher risk to develop seizure, which is 8 times higher in a hemodialysis patient compared to a common population. And hypotension is also a frequent complication that can occur in a kidney patient who's undergoing dialysis. And finally, my action plan would be, first I would stop the dialysis, and then I will infuse the patient with IV fluids, and then when the patient is seizing, we have to time the seizure, keep the patient left lateral, and then if the patient's SpO2 is not picking up, we have to provide patient with adequate oxygen, and I have to start with anti-seizure medication. And for the dialysis part, maybe after the primary cause of the seizure have resolved, in case we want to continue patient with dialysis, we have to try to do a different dialysis technique where there's a few like ultrafiltration, cool dialysis, bicarbonate dialysis, or the sodium modeling dialysis in order for patient to go through the dialysis session. And also we have to keep in mind where if patient is on medication such as antihypertension medication, we have to avoid it before initiation of dialysis. And in case patient unable to tolerate hemodialysis, we can consider giving options to patient and relatives whether they want to consider to do peritoneal dialysis. Yeah, that would be roughly what I will explain to the patient and patient relatives. In case they have any questions, I will try to explain according to my experience and my knowledge. But in case they are not satisfied with my explanation, maybe I will ask help or seek help from my seniors, my specialists or my consultants, in order for them to give so that the relatives will have a better explanation on what is going on with the patient. Yeah, thank you.